Welcome to Balanced Health. I'm Shirley Rose, and this is Joe Costello. You know, we all know exercise is important, and for years we've heard about the benefits of aerobic exercise, weight training, and participating in sports. While these types of exercise are useful and important, they may not be addressing all our conditioning needs. It's our body core that provides the basis of every movement we make, and if not properly conditioned, you could be setting yourself up for strain or injury, especially if you're sedentary. Today we're discussing new methods of training that focus on our body core. Joining us to discuss this topic is Dr. Terry Smith. Dr. Smith is a chiropractor and a certified strength and conditioning specialist who uses the most effective treatment and exercise technique to help his clients reach their highest levels of performance in the shortest amount of time. Welcome, Dr. Terry. It's so nice to have you back again.
Thank you, Shirley. Thank you, Joe.
Always a pleasure.
High levels of performance in short amount of time.
Yeah.
You got my ears have perked up immediately.
Yeah, I was asking
We're
Joe.
going to make you, Joe, basically an NFL linebacker in 6 weeks.
How about by the end of this show? Because I'm on a real tight schedule.
I think we might be able to accomplish something.
I just want to tighten my core in a short amount of time. How about that?
That's a great topic for a show, core strengthening and core conditioning.
It is, and I tell you, I have a personal story with my husband. He strained his abdominal muscles right stopping a horse too quickly, and so he was on crutches for a while with his abdominal strain, and then by the time his stomach had healed, his back was totally thrown out. And so he had to go into physical therapy and all that, and actually ultimately just joined a gym, started stretching, started strengthening his core, and he was fine. So it's very important, isn't it, to have a strong core so that you don't injure yourself. Yeah,
front and back of the spine. A lot of times people think, oh, back pain, but they forget about the whole front part of the spine as well, which is, the psoas and the hip flexors and the abdominal muscles, and they're very, very important in controlling back pain. And we see a lot of patients that come in with unknown back pain, but it's just a kind of a ramification of having a weak core.
Well, so then as we set the stage for what we're talking about today, core training, we want to make sure that our viewers don't think that we're setting them, on a journey of a hardcore training thing for the triathlon. We're talking about core training as a form of exercise, but also as a holistic health application to our bodies, right? I mean, for people that are suffering with arthritis, hip pain, joint discomfort, throughout any part of the midsection, strengthening that core helps aid the healing process, even though that might be a couple feet away from where the pain site is, correct?
Correct.
Well, first we have to define what the core is. Would you do that for us at the very beginning here, and then?
Well, we're going to call core kind of somewhere just underneath the neck, all the way to about mid-thigh kind of area.
Not just your abdominal muscles.
Not just down in that region, but kind of from here to here.
Oh, okay.
And if you just think of student syndrome, how the students sit in class, how they're all slouched and their heads are kind of like this.
Sit up, Joe.
Just sitting up straight. That's core. Basically, everything from here down to your mid-thigh area.
Very interesting. Very interesting. So it does include your hips, your lower back, your upper back, shoulders, and everything.
Yeah, shoulder blade syndrome. A lot of I don't know if you've seen the kids' backpacks these days with 20, 30, 40 pounds of books and stuff. And they're all getting this weak core syndrome because they wear these heavy backpacks and they get to class and they just want to do this. Had a kid yesterday, same thing, came in with just completely, her core was so weak, her shoulder blades were popping out the backside, the scapulas, the wing bones where they're showing out the backside, and she couldn't even press her abdominals inside like this. That was giving her a lot of back pain. So there's a progression, like you said, Joe, not just like hardcore training like you see on those Under Armour commercials or whatever, but I mean, there's a progression, everything from just sitting up straight and breathing, to hardcore V-ups and, gymnastics types maneuvers. So there's a big progression.
And what we're going to do today, Shirley and Dr. Smith, is we're going to show our viewers some real simple applications in our next segment here. Some real simple applications that they can do at home in a fairly short period of time with little or no investment. Because what we see today is a lot of people will do some weight training. I went through the same syndrome myself. Many years of cardiovascular training and weight training, just trying to stay healthy. I kind of ignored my core, especially the abdominal area. We kind of all do at the age of 25. But since I've been paying attention to it, I've been seeing Dr. Smith less, at least on a professional level. So talk about how that actually will help strengthen. You talked about the SI joint and the psoas muscle in the front and stuff like that. So people who are suffering with back pain, shoulder pain, hip pain, core training does make a difference.
It absolutely makes a difference. And here's the thing that kind of discourages a lot of people. When you are deconditioned and your core is really weak, when you start training, sometimes it hurts a little bit more. And you've got to go through that just a few weeks of initial pain. I'm not talking searing, burning pain. We're talking mild discomfort so that the muscles can start to relearn a process, recondition. And you might have a little bit of pain at that first start of, you know, doing the core training, but it should go away fairly quickly, and you should get to that point where, hey, yeah, I didn't even notice, Joe, but you are seeing me less a little bit lately. And that's a good thing. That's a good thing.
Well, one thing we always tell our people is if you're doing the right things, symptoms are good. If you're doing the wrong things, symptoms are bad. So that's a case of that, right?
Exactly. Well, I have a very important question for you when we get back, and that's if you do have a weak core, what are some of the problems that you can have? But we're having a great discussion here, but it is time for a quick break. And when we return, Dr. Smith will demonstrate some moves we can all do at home to begin strengthening our cores. So don't go anywhere. We'll be right back with more Balanced Health.